Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. This morning, we're joined by the state health officer, Dr. Thomas Dobbs, for an update on the COVID-19 pandemic. Should Mississippians be concerned about potential new outbreaks? And are we letting our guard down too soon? And what can be done to vaccinate more of our family and neighbors? Also, we continue our look at criminal justice in the capital city. Christopher Routh, Deputy Public Defender for Hinds County, joins us with his thoughts on violent crime and bottlenecks in the county's court system. That's all ahead on Mississippi Insight. First this morning, State Health Officer Dr. Thomas Dobbs joins us via Zoom. From the start of the pandemic, Dr. Dobbs has been on the front lines of Mississippi's response. We're glad to talk with him one-on-one this morning. Dr. Dobbs, welcome to Mississippi Insight.
Hi, good morning. Thank you for having me.
Well, let's start off with an overview of the pandemic at this point. Your health department has documented about almost 320,000 cases of COVID-19 infection. Almost 7,400 Mississippians have died from the virus. But while we still see daily death reports from COVID-19, both mortality rates and new infections have fallen substantially since the worst of the pandemic here around the top of the year. So, Dr. Dobbs, what are your thoughts today about our progress against this killer virus?
You know, we're certainly ahead of where we were a few months ago, and we're seeing less cases and deaths every day, but the pandemic isn't over. You know, we still have a large population of vulnerable individuals. We're beginning to realize more and more certain people, especially people who are immunosuppressed because of cancer treatment or transplants, aren't going to have a good response to the vaccine. And we have a large percentage of the population that's not immune because they haven't been vaccinated. So we're still at risk. And even though we're going to have a lower number of cases and a lower number of deaths, we think in the coming weeks and months, it's cumulative, right? If we have 5 deaths a day, that's going to end up being 1,500 more deaths. These are people that don't have to die. It's even more tragic that we have a very simple and safe pathway to prevent hospitalizations and deaths, and too many Mississippians are not making the choice to get vaccinated.
Hasn't testing for COVID-19 dropped off from the levels that we were seeing earlier this year and late last year?
Yeah, testing's dropped off, and for Mississippi, it's not really a reflection of anything more than symptomatic people, because that's really been, if you track it, it really sort of correlates precisely with our case burden and symptomatology. So that's not going to be something that's going to help us going forward. But it's really the cases, and if you look at our website, we also have this thing called COVID-like illness. That's a syndromic surveillance mechanism, and the cases in the CLI number, the COVID-like illness surveillance number, is really the indicator of where we are. That's been the most accurate.
How concerned are you about COVID-19 variants, especially the so-called Delta variant that has been spreading so rapidly around the globe?
Yeah, no, I'm very worried. We've seen about a dozen cases of the Delta variant in Mississippi so far. In England, where they had the B.1.1.7, which is our majority of our cases right now, it was basically supplanted by the Delta variant. And so we suspect that could happen in Mississippi in coming weeks or months. Now, the thing that's worrisome about the Delta variant is it's very contagious. It's even more contagious than the UK variant, right? And it may be more deadly, and it might be slightly more resistant to the vaccine. It looks like the vaccine, at least 2 doses of especially the Moderna and the Pfizer, are probably going to be pretty potent. So it's extremely important. But the more we all do to get vaccinated, we keep it from circulating in the community.
Your department reports about 1,067,000 Mississippians have had at least 1 dose of the vaccine. 946,000 of us are fully vaccinated, but we still sit at the bottom of the list of U.S. states for vaccinations per capita. Dr. Dobbs, how seriously do you and your colleagues take these relatively low numbers?
Yeah, I think it's worth looking at it from the different sort of risk profiles. If you look at our 65 and older, that's where our main vulnerability is. We've done a pretty good job. We're over 75% of those folks have been vaccinated, and that's why we're seeing all the benefits. But our real problems we're seeing are going to be in the 40-year-old folks and the 50-year-old folks. We saw a pretty significant increase in the proportion of hospitalizations and deaths in the people in their 40s. I mean, if you're healthy in your 40s, you're not invulnerable. COVID can make you sick, can put you in the hospital, can even kill you. So there is a lack of appreciation and respect for the bad things that this virus can do. I mean, we take it very seriously, and obviously we'll do anything we can to make sure getting the vaccine is so easy. And I would almost say that it's the easiest in the country to get a vaccine in Mississippi. That's what we can do. But we can't do everything by ourselves. If you look at counties like Jefferson County, where they've had a fantastic result in their immunizations, I mean, sure, we've done our work, but it's the local leaders, and it's the local health system, and it's the community health center, and it's the population who work together with those leaders to make it happen. This is a team effort. It's not a Department of Health thing. It's not a doctor thing. It's a all of us thing.
What else do you think it will take to get the remaining state population vaccinated, like incentives, giveaways, mandates? What might it take?
Well, it's going to be difficult, I think. I mean, we don't anticipate as many people are going to get vaccinated as we want to. We do really need to make sure we double down on our vulnerable folks. So if you are 65 and older and you're still not vaccinated, you got to do it. If you have diabetes, if you have hypertension, I mean, we really need to protect the vulnerable. But also, if you have a family member who's on dialysis, if you have a family member who has cancer or is on immunosuppressive medications and you're not vaccinated, you are putting that person at risk, right? So it's not only a state team, it's a family team. And that's where we really need to spend additional effort. Of course, we want everybody to be vaccinated. We have looked at some different incentive models, and what we can do with federal money is very restricted. A lot of the stuff that's been done elsewhere has been really state money. But to be honest, those results are somewhat tepid. It hasn't really been, blockbuster results. It's down to us, basically to not only protect ourselves, but be willing to protect our neighbors.
What do you say to some young people who don't want to get vaccinated, particularly young women who say that the vaccine could make them infertile?
That's nonsense. It's just made up nonsense. There's nothing to do with the vaccine and infertility. The one thing I think about the vaccine I want everybody to understand is when you get the vaccine, you get the smallest little bit of the genetic material that teaches your body how to make the spike protein. And that's it. And so from that little spike protein, you develop a full complement of immunity, which is fantastic, right? Well, if you get the virus, you get that and you get everything else, right? So if you're getting the COVID disease, you're getting what's in the vaccine plus a lot of other stuff that you definitely don't want, and it's a competent virus that's going to make you sick. The way things are, you're almost certainly to either get the vaccine or to get the full-on virus, right? And under every circumstance available that you can think of, the vaccine's the right choice.
We've heard some state politicians casting doubt on the need to vaccinate more Mississippians. Just one example is Republican State Senator Dan Eubanks. He has claimed incorrectly, that we know, that the CDC data shows thousands of deaths as a result of COVID-19 vaccinations. He's not the only lawmaker to voice skepticism about the vaccine either. What is your response to that skepticism? There have been only a handful of deaths from COVID vaccine, and they all have been attributed to the few deaths from the Johnson & Johnson. Association is not causation. Just because someone dies in the same week they get a vaccine does not mean it's from the vaccine. And we've looked at a bunch of these cases, and it has been absolutely unrelated to the vaccination. We lose 65 people a day in Mississippi over the age of 65. And you can imagine, given the over 1 million doses we've had, just out of random chance, you're going to have some people who are going to die the same day or same week they got the vaccine. It's just going to happen. It's not a cause. It's random coincidence. And it's just not true. And CDC has a nice MMR that really outlines this. And so look at data. Don't look at, at Twitter memes or whatever. Dr. Dobbs, thank you very much for joining us this morning.
Thanks for having me.
All right. And we'll be right back. Welcome back to Mississippi Insight. We turn again to criminal justice in Jackson and Hinds County. Last Sunday, we spoke with District Attorney Jody Owens about the prosecution side of justice, but for every prosecution, there is a defense and the presumption of innocence until guilt is proven in a court of law. Joining me now in the studio is Christopher Routh. He's Deputy Public Defender for Hinds County. Chris, welcome to Mississippi Insight.
Thank you. Good to be here, Byron.
Start off by reminding our viewers what a public defender does in our criminal court system and how it works.
So a public defender, everyone accused of a crime in the United States is guaranteed defense by the Sixth Amendment to the Constitution. So in those cases where someone can't afford to go out and hire their own lawyer, the law says that the government has to appoint a lawyer, has to give someone a lawyer for free to defend them against criminal charges. So that's what we do in Hinds County. For everybody who's accused of a crime in Hinds County, of a felony crime in Hinds County, the Hinds County Public Defender's Office steps in and represents that person through all phases of that criminal accusation, from the initial appearance through indictment, through all the way up to trial if necessary. So we provide that representation for folks who can't afford it.
What kind of cases are you seeing, and how frequently are these crimes that you're seeing?
So we represent folks accused of every felony crime there is. We've got everything from simple marijuana possession all the way up to capital murder. We represent folks accused of those things every day in every courtroom in Hinds County on a felony level. So we see a lot of the lower end. We see a lot of drug crimes, a lot of property crimes, but then we represent everyone accused of murder who can't afford to hire an attorney or our office doesn't have a conflict with. How busy are you, and what's your caseload like? So public defenders, we're always busy. We're always very busy. There's always a demand for our service. We're always representing people. We're always striving to present to people or give people the best representation that we possibly can, because that is so important when the government brings all of its resources, all of its power against someone, accuses someone of a crime and tries to take their liberty. We have to step in and represent those people in every single case, in every single time that it happens in Hinds County, and we take that responsibility very seriously. So we're always busy, we're always getting new cases in, and we're always working to resolve cases and keep them moving as fast and efficiently as possible. What are your biggest concerns in terms of your office's ability to work through the current workload? So the current situation is backed up. There's no doubt about it. But we are constantly, like I said, we keep working at it, because every person, while we still have to move those cases as efficiently and fastly and quickly as possible, each person still has to have individualized and competent and zealous representation in every single case. It's not just about the thousands of cases we have sometimes, it's about that one case. Our office practice what's called, or what we refer to as client-centered representation. And by that we mean that we're taking the needs, and the well-being of each particular person, each particular client we have. That is our utmost priority in every single case. How has the recent rise in violent crime, particularly in the city of Jackson, impacted your office? So it's, there's always demand for our services. Again, it's, the Public Defender's Office isn't going anywhere. In fact, we're the only side of the equation that's guaranteed by the Constitution. We have to be there no matter what, and we will continue to be there. Like I said, we represent people no matter how they come to us, whether it's accused of murder or accused of something lesser. We take those people and represent them zealously and to the best of our abilities every time. What impact did COVID have once the court shut down and then finally reopened? What impact did that have on your office? It was actually mixed, Byron. COVID obviously threw some monkey wrenches into some things. It complicated some things as far as getting into court. But in the same breath, we realized and the court system realized that some of those hardships were coming. So we worked very hard to resolve some cases, to get people out of jail, to get people out of situations where the virus was another added threat to them. We had DA Jody Owens here last week, and he talked about the focus on decarceration or curbing mass incarceration. From the defense perspective, what do you think of the DA's efforts on that front? I commend DA Owens on trying to do some of those things. The backlog is still there, and we're still seeing some of those issues. We're still seeing juveniles charged with crimes as adults, facing decades in prison for things that happened when things alleged to have happened when they were as young as 13 years old, and we're not seeing the ability to resolve cases that should be resolved, that decarceration, or that should lead to decarceration, as much as we want. And I recognize that Corona complicated that situation, but when we talk about things like pretrial diversion programs, one thing that's always that we always have to take into consideration is the cost of those things. Those programs cost money, and they cost a lot of money. The people we represent, by definition, are indigent or do not have the money, have been found by a court to not have the money enough to hire an attorney, and a lot of times not even to afford pretrial diversion programs. So that creates an issue for us.
What's your thoughts on the federal dissent decree and how it's impact defendants going through Hinds County court system?
So our concern with that, and I mean, it's no secret that Hinds County and particularly the jail has had its share of issues and continues to have its share of issues. Our concern is always our client. And how that impacts individual people. We always try to look out for when those issues arise, when people are sitting in jail for a long time, looking at what we can do to resolve those issues as quickly and as efficiently as possible.
What's your thoughts in terms of criminal justice reform or court reform? What needs to happen and what needs to be done?
I think we need to generally, as a society, start looking away from policing and prison being the only means of resolving issues. I always say that crime is not always a problem, it's the symptom of a problem. And I don't believe that we can prosecute or imprison our way out of those problems. And especially looking from the perspective of the public defender or looking from the perspective of someone who represents poor people every day. We see every day people who are in situations to where they have no real recourse. They have no other issues or no other ways to survive, and that leads to crime, and that's a societal problem that needs to be fixed. So a lot of times we can focus on other things, on fixing the problems rather than the symptoms.
So what do you say to citizens or victims of crime who say, hey, we need more police. We want to just throw people in jail because it's getting out of control. How do you address the other side?
I would say, look at the situation that we're in. We've been going down that road since the 80s, since the 1994 crime bill. That's gotten us to the point to where we have, Mississippi has the fourth highest incarceration rate in the country, the fourth highest state, and Mississippi has a higher incarceration rate than any country on earth. North Korea, Russia, China, anyone. We're above all of that. And I echo and I agree with DA Owens that that's not an issue with the hearts and the character of the people of Mississippi. So something's off, and it's not with Mississippi. It's with the way that we as a country and we as a society have decided to deal with our societal problems.
We have 60 plus murders now in the city of Jackson. How do you deal with or address those issues if not arresting or locking them up is not the answer?
And I'm not saying that we should just stop arresting or prosecuting any crimes, but those people, or anyone accused of a crime, has to have a zealous representation. when that happens, when they're accused of a crime. And that's what we're here for. But public defenders are usually in the position of the unique position of kind of advocating against their own jobs. I would love nothing more than to have less work to have to do, to have less murders to have to deal with. But I don't think that we as a society or a country can simply lock enough people up to make that stop. We have to fix the societal and other problems that lead to these situations.
With everything that happened in 2020 and what we're seeing now, do you see the country or even our community changing in the next couple of years? Do you see things getting better, or are we going to get worse before we get better?
I hope so, Byron. I hope we are changing for the better. I hope that people are beginning to see some of these situations, beginning to see that the way we do things isn't working. But being a pessimist and seeing what I see every day, I'm not encouraged by the way that we continue to go. But I am hopeful, and we're going to keep working to make sure that people's voices are heard, and specifically people who were accused of crimes by a system that is sometimes oppressive, that is most of the time silences or tries to silence people's voices. We're going to keep working to make sure those people's voices are still heard.
All right, Chris Routh, Hinds County Public Defender's Office, thank you for joining us.
Thank you.
Good talking with you. All right, and we'll be right back. Our thanks to State Health Officer Dr. Thomas Dobbs and Chris Routh from the Hinds County Public Defender's Office for joining us this week. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown. From all of us here at 12 News, make it a great weekend.